अरे
Wait for some minute time.
हाँ तो तेरी बात जा रही है।
लेफ्टिंग मीटिंग क्यों कर देता?
किने
पता नहीं, नहीं है मेरा।
बहुत बड़ी
कमलेश रानी लेफ्ट हुई है।
तू
Good afternoon, everyone. I am Vikas Sharma, professor at Mahatma Gandhi Nursing College, Jaipur, Rajasthan. I'm going to be the next host of the rest of the session of this conference. Moving toward the next session of this conference, that is research paper presentation. At the outset, I would like to welcome scientific session chairperson for this session. In this context, I would like to take this opportunity to invite one of the scientific session chairperson, Dr. Maharaj Singh, who is currently working as professor cum vice principal and PhD research coordinator at NIMS Nursing College, NIMS University, Jaipur, Rajasthan. He has 17 years of working experience. He has published 52 research articles in reputed national and international journal and 5 research patents. He has presented 18 scientific research papers at various conferences and workshops as well. He has been a resource person, guest speaker, and chairperson of scientific paper presentation at various national and international conference and workshops. He has also received a Florence Nightingale Award from Rajasthan Nursing Council, Jaipur, Rajasthan. He is also the member of numerous professional organizations. Now, we would like to hear from our first scientific session chairperson, Dr. Maharaj Singh. Over to you, sir. Dr. Maharaj Singh. Okay, maybe he's not able to connect us. So I would like to tell about our next scientific session chairperson, Dr. Karuna Sharma. She is the HOD cum professor, SGRT College of Nursing, Amritsar, Punjab. She has done her MSc in OBG Nursing from RGHS Karnataka, Bangalore in 2010 and PhD from Himalaya University in November 2016. He has overall 20 years of teaching experience and 5 years, 6 months of clinical experience. He has published 18 paper in various national and international journals. He has attended many national and international webinars and conferences on various topics of research and midwifery and gynecology. She is the lifetime members of many organizations such as SOMI, NSS, NTAI, and Trained Nurses Association of India. Now, this is the time to hear from our scientific session chairperson, Dr. Karuna Sharma. We would like to hear from you, ma'am. Over to you, ma'am. Am I audible to you? Dr. Karuna Sharma. We are waiting to hear from our scientific session chairperson, Dr. Karuna Sharma. Maybe she's not able to connect us. By the time we would like to hear from Dr. Maharaj Singh, our first scientific session chairperson. Sir, am I audible to you?
Yes, sir, I am here, sir.
Yes, sir. Sir, all the attendees would like to hear from you, Dr. Maharaj Singh.
Yes, sir, you can.
Sir, over to you.
Yes, you can ask, sir, for starting the first presentation, sir.
Okay. So now we are going to start the scientific paper presentation. In this context, the first paper presenter is Anupama Jain. अनुपमा Jain. So Mrs. Anupama Jain, you can start with your presentation.
Good afternoon, everybody. Am I audible to all of you?
Yes, you are.
Yes, you are
Okay.
audible.
Thank you, sir. Myself is Anupama Jain, and I'm going to present my scientific paper on ginger's potency in reduction of pregnancy-induced nausea, vomiting, and retching. I'm very thankful to FONS that this conference has given me chance to present my scientific paper. A systematic review is a summary of the medical literature that uses explicit and reproducible methods to systematically search, critically appraise, and synthesize on a specific issues. It synthesizes the results of multiple primary studies related to each other by using strategies that reduce biases and random errors. Systematic reviews are often called overviews. So introduction of my paper is pregnancy is a normal body mechanism and results in physiological, psychological, metabolic and social changes occur in mothers. The mother experiences some body changes right from her first trimester of pregnancy. As each woman are unique and different, so experience and present different signs and symptoms, and it is not a must that all women should represent the same sign and symptoms. But some pregnancy changes become difficult for pregnant women if not treated timely and may negatively affect health of mother and outcome of pregnancy, such as nausea, vomiting, and retching in pregnancy, and it is also called as morning sickness. Up to 80% of pregnant women experience morning sickness during pregnancy. The nausea, vomiting, and retching are unpalatable manifestations which impinge upon the overall well-being, the productivity, and might result in hospitalization of pregnant women if not treated on time. There is growing evidence concerning the effectiveness of ginger in alleviating nausea, vomiting, and retching in pregnancy. Therefore, it is sought to conduct a systematic review to explore the effectiveness of ginger herb for morning sickness. Ginger herb is being used widely to treat morning sickness nowadays. Here we will look at ginger herb being used as the recent therapeutic measure to manage pregnancy-induced nausea, vomiting, and retching. The aim of this systematic review is to compile and compare those studies in which pregnant women had gone through some ginger herb treatment to manage morning sickness for better pregnancy outcome. The methodology of this systematic review is 2 true experimental, 4 quasi-experimental, and 1 pre-experimental studies were included in the review. Based on the objectives of the current review, inclusion and exclusion criteria were prepared and various databases were used in the selection of the studies. The collected studies were deeply checked and reviewed for clarity and authenticity of contents and then has been used for the review. The inclusion criteria of this systematic review is that studies where the participants were pregnant mothers, where the woman between 4 and 12 weeks of gestation with pregnancy confirmed by urine pregnancy test and having morning sickness. Studies that include ginger herb as an intervention for management of morning sickness, and those articles which were published in English language and peer reviewed from 2011 to 2022. Studies that result in reduction in morning sickness by ginger herb. The exclusion criteria were participants who do not come under eligibility criteria of gestational week, studies that include those participants who are not having morning sickness, and unpublished articles were excluded from this review. Electronic database which were used to search these articles, there were a lot of databases, but I am just concising the name of these databases: PubMed, Web of Science, Online Journal, Access Open, Google Scholar, Online Libraries, Image Open. And the keywords which were used during this review is pregnancy, ginger, nausea, vomiting, morning sickness, systematic review. Data extraction and quality assessment. Prisma flow diagram was used to select and extract the articles. Eligibility criteria were assessed of extracted data if these can be a part of the review. Included studies were evaluated for relevance, clarity, completeness, appropriateness, and methodology. Here we can have a glance on the Prisma flow diagram, which was used in the preparation of this systematic review. There are 4 steps: identification, screening, eligibility, and include of the eligible studies. So in the initial stage, 174 articles were searched and sought out for the systematic review, and additional articles also found out through other sources that were around 12. So databases, through the databases, 174 and 12 total articles were searched, and the articles after duplication were removed. After duplication, 91 remained, and articles screened on basis of title and abstract. 75 articles were remained, and full text articles assessed for eligibility, and 15 articles remained, and total जो lastly articles were selected were 7 in numbers. Analysis. The following steps were used in the analysis: tabulation and classification. Obtained data were tabulated and classified as author, year of publication, research design, number of participants, sample characteristics, type of intervention, and treatment setting and research gap. Second step is identifying the findings of the studies. Third step is categorizing the findings. These 3 steps were used. Result sought. The review study included 186 potentially relevant articles, out of which 95 studies were excluded as duplicate. 16 articles were excluded on the basis of title and abstract. 60 were excluded as they did not meet the inclusion criteria. 9 articles did not mention the intervention, and finally 7 studies were included for the review. Characteristics of the articles. Out of 7 studies included in the review, 2 were true experimental, 4 were quasi-experimental, and 1 was pre-experimental research study. And the majority of the interventions were conducted in antenatal clinic. All the studies included participants, pregnant mothers who were suffering from morning sickness. These studies were published between 2011 to 2022. Here we can have on these research. The name of author is Renuka K. Year of publication to 2011. Research design was used quasi-experimental. Number of participants was 60, and sample characteristics pregnant mother. Intervention type was ginger tea, and treatment setting was rural community. And the research gap which was seen in this research study was that it was limited to rural population, and no number of cases is very small. Need to do further study on large sample for the conducive results. Satya, 2012, it was a pre-experimental study on 30 pregnant mothers, and ginger extract was used as intervention. It was done in PSC, and findings were constrained due to small size and limited time frame to conduct research. Kamu, 2017, it was a quasi-experimental study on 60 pregnant mothers, and ginger tea was used as an intervention. It was done on urban PSC, and the research gap was that a small sample size and limited time frame to conduct the research. Purneswari et al. In 2018, two experimental study on 30 pregnant mothers. Ginger tea was used as an intervention, and it was done on in NMCH. And small sample size limited to rural areas can be done on large. It was done on 60 pregnant mothers, and ginger tea was used as an intervention. It was done in ANC, and the research gap which was noticed that it requires large healthcare setting to do the studies on large sample size. Sudiksha S. Binida K. and Ranjita D. in 2021 done a true experimental study on 60 pregnant mothers using the ginger tea as an intervention. It was done on rural community, and the research gap which was noticed that it requires comparative studies between rural and urban areas. Hazarika B. Besha K. in 2022 done a quasi-experimental study on 60 pregnant mothers and used the ginger tea as an intervention, and it was done in ANC, and the research gap which was noticed that intervention time was very short and it can be increased. So limitations of the review. This review has some limitations. First, this review included only published literature and English literature in English, and this would have resulted in missing of some crucial information. The second limitation of this review was that it is based on a small number of studies. It could be done on the large number of studies. And the conclusion of this review is that in this paper, review has been the review has been done on the research studies related to efficacy of ginger on pregnancy-induced nausea and vomiting. The systematic review highlight research gaps labeled as RG1 to RG7. It is important that researchers identify success factors and critical factors in successful deployment of intervention and measures to manage and treat pregnancy-induced nausea and vomiting. Interventions such as ginger herb for reduction of morning sickness could be conducted at various levels of healthcare system. Effective mechanisms need to be implemented to apply treatment measures for better outcome of pregnancy. Ginger is safe, cheap, and easy accessible herb as evidenced by many research studies. No financial support was achieved for this review, and no conflict of interest was seen. Here are some references which were used for this review. Thank you.
Thanks, ma'am. It was a nice presentation. Now we would like to have input about your presentation. Scientific system chairperson. So first of all, I would request Dr. Maharaj Singh to give some input on this presentation. Dr. Maharaj.
Yes, Dr. Anupam, your presentation is excellent. Okay. And I request you to say one thing, that you have done this study as a systematic review. So at the time of selection of this study, what was the conflict of interest? Anupama, am I audible? At the time of selection of the study, what was the conflict of interest in this?
Mrs. Anupama, can you hear? Sir, maybe she is not able to connect us because of impairment in internet connection.
Okay, right, sir.
Okay, so we'll proceed for the next scientific paper presentation. And
someone sir should maintain the time limit. As
Definitely,
Deepesh sir was mentioning the time also.
Definitely, sir. I'm going to announce it now. So before commencing the next paper presentation, I would like to tell all the presenters to limit their presentation up to 5 to 7 minutes. So the next paper presenter is Reshita Jaslin.
Yes, ma'am. Yes, sir. Good afternoon, sir.
Yes, you can start your presentation.
Yes, sir. So this is visible, sir.
Yes, it is visible. You can proceed.
Okay, sir. Good afternoon to everyone. So I'm going to present my scientific presentation. The title is Effectiveness of Autogenic Relaxation Therapy Among Adolescents in Selected Schools. Introduction. Adolescents face a variety of academic challenges in today's fiercely competitive world, such as exam stress and lack of interest in attending classes. In India, it was found that 1.9% of school children had severe stress and 93 to 100% had medium to moderate stress. Consequently, pinpointing the origins of stress would aid in the creation of effective in-school tracks to help people lower their stress levels, which will eventually promote a person's general well-being. In Punjab, India 2023 revealed a high prevalence of stress among adolescent schoolgirls between 15 to 17 years, showed that 68% of experienced stress. Factors contributing to the high stress levels included academic pressure and poor study habits. Objectives of the study: assess the level of stress among adolescents between the experimental and control group. Assess the effectiveness of autogenic relaxation therapy on stress among adolescents between the experimental and control group. Design of the study: quantitative research approach with a true experimental pre-test and post-test research design. Setting: was conducted in Selva Damodaran Higher Secondary School and Kajamian Higher Secondary School at Tiruchirappalli district. Population of the study: the accessible population for the study was adolescents between 13 to 15 years of age studying in 8th, 9th and 10th standard in Selva Damodaran Higher Secondary School and Kajamian Higher Secondary School at Tiruchirappalli district. Sample size: 40 adolescents were selected for the study, experimental group 20, control group 20. Sampling technique: simple random sampling technique in that lottery method to select the sample from the respective schools. Methods: academic stress was measured by ESA, educational stress scale for adolescents, and an autogenic relaxation therapy was provided daily for 8 subsequent weeks. Post-test was done at the end of 8 weeks. The total autogenic relaxation session for participants lasts for about 20 to 25 minutes for experimental group only. Criteria for sample selection: inclusive criteria: students between the age group of 13 to 15 years studying 8th, 9th and 10th standard who know Tamil or English, students who are willing to participate in the study, students who are available at the time of data collection. Exclusive criteria: who have already attended the therapy. Description of the tool: demographic variables part A. Part B: modified educational stress scale ESA. It consists of 20 items. Each item has 5 alternatives on a 5-point scale. Procedure for data collection: the study was conducted, selected schools at Tiruchirappalli district in Tamil Nadu. Before conducting the study, written permission was obtained from concerned authorities. The data were collected for a period of 8 weeks in the month of July to October 2023. The researcher gave brief information about the introduction and the purpose of the study to the respondents. The respondents were made to sit comfortably with a well-ventilated room. The researcher collected the data related to demographic variables and conducted the pre-test to assess the level of academic stress in the experimental and control group. In the experimental group, the researcher implemented autogenic relaxation therapy ART to reduce the academic stress and increase the academic performance. The ART was taught to the participants for 20 to 30 minutes, the same procedure to be continuously followed for 8 weeks. The researcher was instructed the participants to follow intervention daily. Control group was requested to follow their routine work. Post-test was conducted for experimental and control group by using of modified educational stress scale for adolescents after 8 weeks intervention. The result of the study: the finding of the study revealed that pre-test mean score on stress was 70.20, ST 10.53. Control group mean score was 71.90, ST 9.89. T-test 0.527, which is not statistically significant at P level less than 0.05 level. The post-test mean score on stress was 45.90, ST 7.57, and in control group 71.30, ST 10.86, T value 8.578 respectively, which is statistically significant at P level 0.001 level. Effective mean score was 0.60, SD 4.04, T value 0.663, which is not statistically significant at P level less than 0.05 level. Conclusion of the study findings: that there is a statistically significant difference in the level of academic stress after proving autogenic relaxation therapy. This proved to be an effective therapy to improve the level of academic stress among adolescents. School-based intervention will promote the mental well-being of the adolescents. Recommendation of the study: the school-based intervention will be supported for their academic growth. Additional research needed, especially regarding the ART in academic stress in school settings. If schools incorporate in their curricula, students would likely benefit from them. And the references. Thank you.
Thanks a lot, ma'am.
Yes, sir.
Now, Dr. Maharaj Singh, you would like to have an input on this.
Yes, Rashida Joblin, actually, as we know that the academic stress is a highly prevalent problem among the adolescents because of academic achievements.
Yes, sir.
Selection of problem, I think it's very genuine. But at the same time, I am interested to know that you have conducted the true experimental study. So
Yes, sir.
how do you control the effect of confounding variables?
Yes, sir. During the data collection, I heard many factors like to control the students, and a few students are few dropout was there. And the previous day, I was confirmed with the
No,
principal.
my
Yes,
question
sir.
is how did you control the effect of confounding variables?
Confirmed variable, sir.
Yes,
That means a variable you are asking, sir.
yes, effect of confounding variables.
Little bit clarification I need, sir.
Okay. And my second question is autogenic relaxation technique.
Yes, sir.
Already proven fact that it relieves the stress. So how do you differentiate your study from the previous studies?
Yes, sir. And many review shows that it was effective for reduction of stress, anxiety, and depression, or even to treat for medical illness like cardio problems, etc. Sir.
So how you differentiate it from other studies? That's my question.
As, it means, sir, I didn't understand.
Okay, thank you. Thank you.
Yes, sir. Thank you so much, sir.
Thank you so much, sir. Now, Dr. Karuna Sharma, we would like to have some input from on this paper presentation. Ma'am, you please unmute yourself. We are not able to hear you. Dr. Karuna Sharma, ma'am, you have to unmute from your end. We are not able to do it. हम कर सकते हैं क्या इसको देखो?
नहीं म्यूट कर सकते हैं म्यूट कर गाड़ी में दीजिए
Then we'll proceed for the next presentation. Ms. Anuradha Wankhede. Are you ready with the presentation?
Yes, sir. Am I audible?
Okay, before commencement of your presentation, I would like to remind for the time limit of the presentation that must be within 5 to 7 minutes. So please limit your presentation within this time. Okay.
Okay, sir.
Okay. Okay. Now you can proceed.
Good afternoon, everyone. Myself, Anuradha Wankhede. And so my today's problem statement is assessment of the effectiveness of plant teaching on knowledge regarding physical and psychological women abuse among teenage girls in selected college. Then the introduction of this presentation. The abuse is never a on-time event. Many people who are being abused do not see themselves as a victims. Also, the abusers do not see themselves as a being abused. People often think of domestic violence as a physical violence, such as hitting. However, the domestic violence takes other forms, such as psychological, emotional, or a sexual abuse. The domestic abuse defined as a chronic mistreatment in a marriage, families, dating, and other intimate relationships can include emotionally abusive behavior. So, psychological abuse does not always lead to a physical abuse, but a physical abuse in domestic relationship in nearly always proceed and the accompanied by the psychological abuse. The numbers alone are stunning. Nearly 1 in 5 women, or almost 22 millions, have been raped in their lifetimes, and the numbers don't begin to tell the whole story. They don't tell of the physical, emotional, and psychological scars that a victim can carry for a life. They don't speak to the betrayal and broken trust when the attacker is a friend, trusted colleague, or a family member. And they don't give a voice to a courage of survivors who works every day to put their lives back together. According to a WHO,
the violence against women puts an undue burden on healthcare services, as a woman who have suffered violence are more likely to need health services and at higher cost and compared to the women who have not suffered violence. So the need of the study, according to the data from the National Family Health Survey 3, the women among age 15 to 49 years, so 29% have ever experienced the physical violence and 2% have ever experienced a sexual violence. In all, 29% of women aged 15 to 49 in the Maharashtra have experienced the physical or sexual violence, including 34% of married women, 3 in 10 married women, that is 30%, according to report, having been slapped by their husband, about 1 in a 10 that report having their arm twisted or hair pulled or being pushed, shaken and kicked, dragged and beaten up or having something thrown at them. 1% report that their husband tried to choke or burn them on the purpose. 2% report that their husband physically forced them to have sex. Overall, the 31% of married women have experienced the spousal, physical, or the sexual violence from their current husband or if currently not married, their most recent husband. 18% report spousal emotional violence and only 1% of the married women have ever initiated violence against their husband. So objective of this study to assess the existing knowledge regarding physical and psychological women abuse among the teenage girls. And second objective is to evaluate the effectiveness of plant teaching on knowledge regarding physical and psychological women abuse among teenage girls. So the methodology of this study, the research approach adopted for the study was one group pre-test and post-test research design. The study comprises of 60 teenage girls of selected college who fulfill the inclusive criteria selected by probability sampling technique. In the simple random sampling technique was used to select the sample by lottery method. The structured knowledge questionnaire was used for a data collection. The content validity of the tool was
Excuse me,
established in
I
the
would like to
consultation
interrupt.
with.
Excuse me, I would like to interrupt you in
Yes,
between.
sir. Yes, sir.
Please try to finish it as soon as possible. We have a lot of candidates after you as well. So you have to limit
Yes.
it within,
Okay, sir. Okay, sir.
yeah.
Okay, sir. So the guide, 14 expert from the field of community health nursing and mental health nursing. The reliability of the study, structure questionnaire was calculated using the split half method. The reliability was found to be 0.8404, which indicate and formal permission was obtained from the selected college for the data collection. So in that section was divided. So in that first section is distribution of teenage girls according to their demographic characteristic. In that the variables are age, religion, caste, type of family, monthly income of the family, place of the residence, previous knowledge about the woman abuse, and source of information where they get the information. So, and second section is assessment of existing knowledge regarding physical and psychological woman abuse. In that, the level of knowledge score is adequate, moderate, and the inadequate, moderate, and the adequate. And the section third, analysis of effectiveness of plant teaching on knowledge regarding physical and psychological woman abuse. So in that, there is a total sample is 60, and in that we are assessing the pre-test and post-test knowledge score. And in the last section, the comparison of knowledge score in a pre-test and post-test. So the result of this study, the revealed that the pre-test mean score among the teenage girls was 10, that is 35.71%, and post-test score up was 17.85%, 85, that is 63.75% in the evaluation. Interpreted that there was a significant increase in a knowledge level of teenage girls after the administration of plant teaching program. So it is evident that the calculated p value was greater than the able value stable value of T at 0.05 level. So these indicate that plant teaching was effective in improving the knowledge of the teenage girls. The study was also revealed that there is a significant association between demographic characteristics such as age, religion, types of family, place of residence, and previous knowledge about the woman abuse with the knowledge score. So the conclusion of this study, the study was done to assessment the effectiveness of plant teaching on knowledge regarding physical and psychological woman abuse among the teenage girls. And the result is the most of teenage girls had excellent knowledge after the administration of plant teaching. So the study was revealed there is a significant association between demographic characteristics. Thank you.
Okay, thank you so much. Dr. Maharaj Singh, we would like to have an input on this presentation.
Brother Wankhede, as one of the variable in your study is the previous knowledge about women's previous knowledge about women's abuse. How did you assess this variable?
Sir, actually, in a structure questionnaire, I'm giving them option like from where they get knowledge regarding woman abuse. So in that, the 4 option is there: TV, from the newspaper, or from the attending seminar, or from attending the workshop.
So that was source, not previous knowledge. Actually, that was source of information regarding this. Okay, and you are supposed to have it as a previous exposure about women, any kind of abuse. Okay, so I think it's a mistake. And second thing, that as how much percentage of improvement was there in the knowledge?
Hello.
How much percentage of
Am I
improvement was
audible?
there in the knowledge? How? As
Sir,
a result of
that is 63.75%.
was there.
Sir, the score is 63.75%. That is improvement in their knowledge.
No, how much the percentage difference I am asking?
The percentage is 63.75.
You are saying post-test result. I am asking for difference, madam. Anyway,
Actually,
okay,
I'm
thank
not
you.
getting your question. Okay, thank you, sir.
Okay, okay.
Okay, sir, thank you. Now, Dr. Karuna Sharma, are you there to give some input? Dr. Karuna Sharma, can you hear? Maybe she is not there. We would like to go for the next presentation. And the Bhanupriya, Miss Bhanupriya, you can start a presentation.
Yes, sir. Can I audio, sir?
Yes, you are audible. Again, I would
Okay.
like to remind you to limit your presentation within 5 to
Sure,
7
sir.
minutes. Please keep
Sure,
in mind.
sir. Sure, sir. Okay, sir. Good afternoon to all. Thank you for your great opportunity to present this paper to me. My name a study to assess the correlation between the muscle strength and muscle cramps among patients with chronic kidney disease undergoing hemodialysis at Puducherry. So introduction, the muscle cramps occurs due to the fluid loss. The keratin deficiency is result in prolonged muscle contraction because of ATP depletions. Normally, the calcium pump on sarcoplasmic reticulum consume the ATP and quickly reappedating, releasing the calcium ions, which rapidly stop the excessive muscle contraction. But in hemodialysis, accumulation of excessive long chain of acyl CoA in mitochondria will inhibit the enzymes involved in the energy production. So in sarcopenia is the weakness of muscle mass and muscle strength because of acceleration protein catabolism due to effect of CKD dialysis procedures along with low energy and protein intake. The low muscle strength is associated with worsen the clinical outcome and quality of life, higher hospitalization and increased mortality rate in the patient with end stage of renal disease. So objective, to assess the level of muscle strength and muscle cramps among the patient with chronic kidney disease undergoing hemodialysis, to correlate the muscle strength and muscle cramps among patient with chronic kidney disease undergoing hemodialysis, and find out to the association between the muscle strength and muscle cramps with selected demographical and clinical variables. In methodology, the design is descriptive design was used. The sampling technique, convenient sampling technique is used. So then the sample size is 50. The setting is East Coast Hospital, Pondicherry. The description of tool. In this part, we are including the clinical patient variables or patient, gender, education, occupation, income, types of so family history and practice of physical exercises. This part, the second part included the clinical variables or BMI, blood pressure, medical history, frequency of dialysis and duration of hemodialysis and weight of fluid removed during the dialysis. And section 2, we are having a muscle cramp questionnaires. In that questionnaire consists of frequency of cramps, duration, level of pain, temperature, discomfort. The score interpretation level of muscle cramps, 0 is no cramps, 1 to 4 is mild cramps, and 5 to 8 is moderate cramps, and severe 9 to 13. And third section, we are having a modified Oxford standard questionnaires, that is muscle strengthening grading. In this level of strength is 0 to 2 is less power, 3 to 4 is moderate power, 5 is high power. It is a standardized questionnaire, so that why we not go for reliability. In muscle cramps, we are under when the reliability score is 0.8. In analysis, we are having a percentage. Figure 1 is presenting here. The figure 1 is presented the percentage distribution of demographical variables. In age, that is 36% of them belongs to 41 to 50 years. In 58% of them belongs to female, and 46% of them having an education of primary. In occupation, the 76% of them have unemployed and housewife. In monthly income, 56% of them belongs to 5,000 to 10,000 rupees, and in religion, the 90% of them are Hindus. In marital status, 90% of them married. In domicile, 54% of came from husband. And lifestyle modification, they are in life. 82% of them have limited activities, and 96 of them have no history of previous kidney disease. In exercise, practice of exercise, 82% of them not underwent the practice of exercises. This results was supported by A.S. Kalner S. et al. 2022 radius study. So they will be supporting that the maximum of them belongs to the age group of 41 to 50 and with the disease condition of hypertension. And also in percentage, figure 2 is presenting here the percentage distribution of clinical variables. In 82% of them, by having the BMI of 18.5 to 24.9. In blood pressure, the 56% of them stage 1 hypertension. In chronic illness, 44% of them have hypertension. The number of hemodialysis they are underwent, 46% of them underwent the hemodialysis for 4 to 6 years. The frequency of hemodialysis per week, thrice a day. 56% of them underwent thrice a day. They are underwent. So duration of hemodialysis, maximum 100% of them underwent 4 hours of hemodialysis. So during the dialysis, 56% of have less than 3 liters only they are taken. The table 1 is presenting the frequency and percentage distribution of level of muscle strength among patients with chronic kidney disease undergoing hemodialysis. In that, there are 84% of them having moderate power. According to this study, the result was supported by Nurkic Sheet 2021. The muscle weakness, they done the comparative study between the dialysis patient and non-dialysis patient. He found out that the result found out that muscle weakness is the independent risk factor for the hemodialysis treatment. And table 2, the frequency and percentage distribution of level of muscle cramps and patient with chronic kidney disease undergoing hemodialysis. In this, 94% of them have moderate muscle cramps. According to Meenum Singh, that is 2015, they conducted a study. This study was supported. There is a 35 to 86% of them having undergoing hemodialysis. They are having frequent of muscle cramps for them. And the last table, that is table 3, is correlation between the on muscle strength and muscle cramps and among patients with chronic kidney disease undergoing. Here there is a positive correlation between the muscle cramps and muscle strain. The patient having a less muscle strain, they are having high risk for getting the muscle cramps with a positive correlation of value of 0.265. In association between the muscle strengthening and muscle cramps, so selected demographical variables and clinical variables among patients with chronic kidney disease. In association variable, monthly income have significant association of muscle strain. In muscle cramps, BMI had significant association of muscle cramps among patients with chronic kidney disease undergoing hemodialysis. The major finding of the study, the majority of samples are belongs to 36% of them 41 to 51 years and 46 of them male and 96 of them having no history of chronic kidney disease and 82% of have no history and practice of physical exercises. In CKD, 42% of have moderate muscle strength with a standard deviation of 4.06 plus or minus 0.512 and 94% of them have moderate muscle cramp with standard deviation of 6.62 plus or minus 1.2. The finding of studies showed that the correlation value 0. A positive, that is 0.26. It reveals that positive correlation between the level of muscle strength and muscle cramps. In association, the income have associated with the muscle strength and BMI is associated with muscle cramps. The conclusion, there is a positive correlation between the muscle strength and muscle cramps. A patient with chronic kidney disease undergoing hemodialysis have poor muscle strength and frequent occurrence of muscle cramps. So early detection can improve the muscle strength and prevent the occurrence of cramps. Encourage the patient to do the regular exercises, take nutritional diet, very essential for the patient with chronic kidney disease undergoing hemodialysis. Thank you. Thank you, sir.
Next नाम बोलो अपना नाम सीधा नाम बोलो.
Thank you, ma'am. Dr.
Hello.
Maharaj, would you like to ask something on this?
Yeah, Bobby, actually, you have tried to establish the relationship between the muscle strength and the muscle cramps,
Yes, sir.
and you have yes, and you have concluded that there is a relationship between both.
Yes, sir.
But but as I was observing the results in your table, it shows that there is no correlation basically between both. So while you are taking only R value into consideration and neglecting the P value, so that results are
The
deviating from that.
significant is not there. Yes, sir. There is a no significant, but there is a correlation is positive. That's why we are.
No,
There's a correlation.
we see only correlation when there is a significant association between both.
Okay,
So
sir.
your result is that there is no relation between both cramps and muscle strength. This is
Yes.
the thing.
Okay, sir.
Hello.
Okay.
Yes, sir.
Thank you, sir. Dr. Karuna Sharma,
Yes,
would you like to ask something?
Yes, am I audible?
Yes, you are.
Yes, ma'am. Yes, ma'am.
Yes. So, what is the scientific relevance of your research?
What is
Bhanupriya ma'am,
the?
what is the
Sir,
scientific relevance?
we have to assist the. We have to further come. We can prevent the further occurrence of muscle cramps and we can improve the muscle strength of patients, ma'am. That's why we have to do the descriptive study. I have to done. So we have to further. We can prevent the muscle cramps and improve the muscle strength of the patients.
Thank you so much. Thank you. So, it's the good presentation.
Thank you, ma'am. Thank you so much.
Okay.
Thank you.
Thank you, ma'am. We would proceed for the next presentation. Miss Shilpa is the next presenter.
Yes, sir.
Yes. So are you ready with your presentation?
Yes, sir.
Okay. And you just need to keep in mind the time limit as well. Okay.
Okay.
Okay. Thank you.
Sir, is it visible, sir? Hello.
Yes, it is visible. Yes, you can proceed. It is visible.
Good afternoon, sir. My study title is Relationship between Physical Activity and Obesity Among Female Residents in a Community.
So, according to Jim Rohn, take care of your body. It's the only place you have to live. Introduction, background of the study. Health is wealth. There is nothing in our life that is more valuable than good health. There are many different things to maintain healthy lifestyle, such as eating healthy, being physically active, maintaining a healthy weight, and managing stress. Lifestyle choices such as unhealthy diet, physical inactivity, sedentary lifestyle leads to obesity. Need and significance of the study. Obesity is a medical condition in which excess body fat has accumulated to the extent that it may have an adverse effect on health. The main causes of development for obesity include lack of sleep, physical inactivity, drugs, diet, emotional factors, alcoholism, and smoking. A BMI of above 25 is considered as obese. People living with obesity have higher chance of developing a range of serious medical issues, which include atherosclerosis, heart disease, diabetes mellitus, hypertension, sleep apnea, osteoarthritis, decreased mobility, lack of self-esteem, and depression. According to WHO, in 2014, globally approximately 39% of women were overweight and obese. Between 1975 and 2016, the combined prevalence almost doubled from the baseline level of 22%. Physical activity decreases fat around waist and total body fat. Physical activity level has declined globally in recent decades. Regular physical activity decreases the health risk associated with obesity. There is also graded inverse relationship between total physical activity and mortality. As physical inactivity leads to obesity, according to WHO, around 23% of adults aged 18 over were not active enough in 2010. In high-income countries, 26% of men and 35% of women were insufficiently physically active. Statement of the problem. A correlational study to assess physical activity and obesity among female residents of selected community areas in Kottakkal. Objectives: to determine prevalence of obesity among female residents of selected community area, to identify the level of physical activity among female residents of selected community area. Third objective is to assess the health risk related to obesity among the female residents, to associate prevalence of obesity with selected socio-demographic variable, to identify the correlation between physical activity and obesity, and the final objective is to plan and implement a health education program based on health risk and preventive measures associated with obesity. Just the research methodology. Research approaches: quantitative approach, research design, non-experimental, correlational, prospective research design. Population: female residing in community areas. Setting: selected community areas in Kottakkal. Sample: female residents of selected community in Kottakkal. The number is 30. Sampling technique: non-probability purposes sampling. Data analysis and interpretation. Analysis is done by descriptive and inferential strategy. Association is calculated by chi-square. Discussion and recommendation. In the data collection process, tools used are tool 1, structured questionnaire for assessing social demographic variable. Tool 2, body mass index, which is used for assessing the prevalence of obesity. Tool 3, waist circumference for assessing central obesity by using centimeter tape. Tool 4, abdominal circumference for assessing central obesity by using centimeter tape. Tool 5, skin fold assessment used by use of skin caliper. Tool 6, mid-arm circumference to assess nutritional status by using centimeter tape. Tool 7, checklist for assessing the level of physical activity. Tool 8, health risk assessment scale used to assess the health risk associated with obesity. The inclusion criteria were female residents who were having physical appearance of obesity, aged between 25 to 65 years, who were willing to participate. Exclusion criteria including the female residents of selected community who were not willing to participate, who were aged less than 25 years, who were not the member of the community. So ethical clearance is obtained from the authorities of Falmouth College of Nursing and Community Medical Officer from Healthcare Center. Informed consent was obtained from the responder prior to the schedule, and considering the confidentiality and privacy of the participants throughout the study. The results were, according to the age, more than 55 years are contributing to 53% of the age group, and 90% of the residents were residing in nuclear family. 57% of the participants having primary education, and considering the income, 30% of the people are having more than 5,000 rupees of the annual income. monthly income. Occupation, 90% were unemployed. Diet, 90% of consuming mixed diet. Sleeping pattern, 33% of the female having sleep immediately after food. 20% having daytime sleep habits. Considering the blood cholesterol level, 47% of the female residents are now checked the cholesterol, and 13% having in a range of 200 to 250 mg per dl. Considering the lifestyle diseases, 53% not suffering from any diseases, 70% having endocrine diseases, 14% having lifestyle diseases like DM, and 3% having more like comorbid conditions. Fast food habit, 30% having rarely the habit of consuming fast food. Considering the treatment, 80% having allopathic treatment, 70% are treating with Ayurvedic medications, 3% with homeopathy. Considering the medication, 33% of having not taking any medication, and 30% having medication for other reason, 20% having taken medication for hypertension, 10% cardiovascular disease, 7% more than one reason. According to section 2, considering BMI, 47% of the category included in pre-obese, 40% obesity class 1, 10% obesity class 2. Waist circumferences, 53% having very high waist circumferences, and 67% are contributing high in considering abdominal circumferences. And considering mid-arm circumferences, 70% of the participants are categorized in obese category. 67% of the female are included in pre-obese while considering triceps skin fold thickness. Section 3, analysis of level of physical activity among female residents. 57% are included in moderate level of physical activity they are performing, and 40% low level, 3% high level. Next section is analysis of health risk related to obesity among female residents. 60% of the females are included in mild health risk category, 37 are moderate, remaining are in the high risk category. Association between prevalence of obesity among female residents with selected socio-demographic variable. We are considering the analysis demographic variables such as food habit, sleeping pattern, and cholesterol level. Then there is a significant association existing between waist circumference and selected socio-demographic variables such as occupation and food habit. Significant association exists between mid-arm circumference and selected socio-demographic variables such as occupation and sleeping pattern. Considering the correlation, there is a positive correlation between physical activity and obesity, that is, decreased physical activity strongly related to higher chance of obesity. Discussion. The findings of the present study were in line with the result of another study to assess the physical activity and obesity among secondary school children at selected schools of Bangalore. The study concluded that there is a high prevalence of obesity and its risk factors, dietary restriction, physical active lifestyle, and avoidance of tobacco. Considering these parameters, the present study concluded that study of the above study is similar to current study, that among female living in a community area, those with decreased physical activity are more likely to be obese, and there is a chance for developing the secondary complications related to obesity. Thank you.
Thank you so much. Now let us have an input on your presentation from Dr. Karuna Sharma.
Hello, am I audible?
Yes, you are.
So how to assess the level of physical activity and obesity?
Yes, ma'am.
How to assess the level of physical activity and obesity?
And there are some checklists we are using for assessing the physical activity. Then there is some exercise parameters we are mentioning in that checklist. So while using the checklist, we are assess the performing that particular ladies are performing these kinds of activities for which help to burn off the fat, because they are mostly without any occupation. They are housewives. So we are giving some simple kind of task in the checklist, usual habits. So while using that checklist, we are assessing that.
So what is the purpose of this study?
In our area, Kottakkal, it is a complete rural area. So there is a more chance of incidence of cardiovascular diseases and thyroid diseases are very common. So we are like a census program, we are starting to collect the data. So what is the main reason for developing these kinds of studies, these kinds of incidents? So the major causes of obesity. That's why for
Okay,
preventing
okay.
this.
It's okay. So it's very good presentation.
Thank you so much.
So proceed the next candidate.
Okay, thank you so much, ma'am. Now the next
Thank you.
paper presenter is Archana Pardesi. So are you ready with your presentation, Mrs. Archana Pardesi? Mrs. Archana, am I audible to you?
No.
Maybe she's not able to connect us, so we'll proceed for the. Mr. Deepak Gupta, the next paper presenter. Are you ready?
Hello, good afternoon, sir.
Yes, sir.
Okay, is there Archana Pardesi?
Yes, sir.
Okay, okay.
Sir, please,
So we will put-
I need to share the PPT.
Okay, okay. You can share and you can proceed.
Am I audible, sir?
Yes, you are. You can proceed.
My slide is visible, sir?
Yes, yes, it is.
Okay, very good afternoon, sir. Respected dignitaries, thank you so much for giving me the opportunity. Myself, Mrs. Archana Pardeshi, PhD scholar from Dr. D.Y. Patil College of Nursing, Pimpri, Pune. Title of my studies, a study to assess the effectiveness of self-instruction module on needle stick injuries among nursing personnel in Dr. D.Y. Patil Hospital, Pimpri, Pune. Objective of the study, to assess the pre-test and post-test knowledge regarding needle stick injuries for nursing personnel, to assess the effectiveness of self-instruction module on needle stick injuries for nursing personnel, to find out the association between pre-test level of knowledge and selected demographic variable of nursing personnel. Research methodology, research approach, quantitative research, research design, one group pre-test, post-test research design. Setting of the study was Dr. D.Y. Patil Hospital and Research Center, Pimpri, Pune. Population, all the nursing personnel working in the Dr. D.Y. Patil Hospital, Pimpri. Sample size, sample nursing personnel in selected departments in the Dr. D.Y. Patil Hospital, Pimpri. Sample size, total 30 nursing personnel in Dr. D.Y. Patil Hospital, Pimpri. Sampling technique, convenient sampling technique. Need of the study, it is estimated that sharp injuries cause about 66,000 HBV, 60,000 HCV and 200 to 5,000 HIV infections among healthcare workers every year. For healthcare workers worldwide, the attributable fractions of percutaneous occupational exposure to hepatitis B, hepatitis C and human immunodeficiency virus are 37%, 39%, 44% respectively. These blood-borne diseases have serious consequences, including long-term illness, disability, and death. In addition, care workers by sharp injury, including those that cause tuberculosis, diphtheria, herpes, and malaria. So the variable, independent variable, self-instruction model regarding needle stick injury, dependent variable, nursing personnel knowledge regarding needle stick injury, demographic variable, age, sex, qualification, type of working area, income, vaccination status, special infection control training program, and the demographic variable, sample criteria, inclusion criteria will be nursing personnel willing to participate in the study and able to write and speak English. Exclusion will be not present during the data collection and not working in the D.Y. Patil Hospital. Hypothesis, the research hypothesis one, there is a significant difference between pre-test and post-test knowledge scores regarding needle stick injury among nursing personnel. There is a significant association between pre-test knowledge scores with their selected demographic data regarding needle stick injury among nursing personnel. Assumption, nursing personnel may not have adequate knowledge on needle stick injury. Knowledge of nursing personnel may vary according to demographic variable. Self-instruction model may be improve the knowledge of nursing personnel on the needle stick injury. Delimitation of the study, the study is delimited to the nursing personnel who are willing to participate in the study, able to read and write English and present during the data collection. The analysis and interpretation of the data were analyzed based on the objective of the study. The data collected from 30 nursing personnel in Dr. D.Y. Patil Hospital and Research Center. Pre-test and post-test knowledge score. In pre-test, 0 nursing personnel having adequate knowledge moderate 20, that is 86.67% of the sample is having moderate knowledge, and the 4, that is 13.33% sample having a inadequate knowledge, where in the post test 24 nursing personnel, that is the 80% sample is having adequate knowledge, 20%, that is the 6 sample having moderate knowledge, and 0% is having inadequate knowledge. So effectiveness of self-instruction module on needle stick injury, pretest score, mean was 13.8, EST 3.5, then post-test 23.43, 3.15, p-value is 11.46, p-value is 2.02. Association between pretest knowledge and selected demographic variables of nursing personnel. There was no association of knowledge score with the selected variable like age, sex, qualification, type of working area, income, vaccination status, total area of experience, special infection control training program among nursing personnel. Conclusion: nursing personnel did not have adequate knowledge regarding needle stick injury. Self-instruction module was very effective in improving the knowledge regarding needle stick injury. There was no significant association between knowledge about the needle stick injury and socio-demographic variable like age, sex, qualification, type of working area, income, vaccination status, special infection control training program. Recommendation: based on the finding of the study, the following recommendations have been made for the further study. A large-scale study can be carried out to generalize the finding. A similar study can be conducted by the true experimental approach. A similar study can be conducted by using the self-instruction module for educating and paramedical professionals. Thank you so much.
Thank you so much. Now let us have an input from Dr. Maharaj Singh on your presentation. Dr. Maharaj Singh.
Archana, as needle stick injuries are prevailing actually among the staff nurses, and
Yes, sir.
you did this study as a part of your MSc nursing or as a staff nurse actually?
I have done it as a while I'm pursuing PhD. I was doing MBA, sir.
Okay.
Also.
When you were pursuing your PhD, you selected this study. Okay. Now, as you have found that your teaching program was actually effective, so,
Yes, sir.
but I want to know actually which are the areas the nurses was having lack of knowledge regarding needle safety precautions.
So the general ward, more specifically compared to ICU, the nurses is having a less knowledge.
No. I am asking not comparison of ward wise. Which are the areas actually the nurses was having lack of safety measures? So they were this needle stick injury was prevailing.
So after once they have they are having a needle stick injury, what are the protocol? I mean, how to clean the wound? What is the protocol? Where to get vaccinated? When to go to OPD to show the doctor? And whether the area in the OT, the needle stick injury is there or in the ward. So they are confusing regarding what to do after the needle stick injury. So in that
that was after needle stick injuries. I am asking for the reasons actually. Anyway, thank you, Archana.
Welcome, sir. Thank you so much.
Thank you so much, sir. Now the next paper presenter is Mr. Deepak Gupta.
Yes, sir.
Are you ready with your presentation?
Yes, sir.
Okay, then you can share your slides and you can
Yes.
start your presentation.
Good afternoon, all of you. My research topic is a study to assess the effective of educational intervention on awareness, attitude, and practice regarding hazards of plastic use amongst the children's. It is the systematic review. First of all, introductions. Plastic is everywhere in today's lifestyle. One among the most hazardous manufacturers is the plastics. It has become a part of every aspect of human living. When any food, material, or water is stored in the plastic container, the small measurable amounts of the materials may migrate into the food and can be consumed with it through the process of leaching. Leaching means that some of the chemicals of the plastic enter the food material or water. It has been well characterized as an endocrine disruptor, which can mimic the body's own hormones, potentially leading to a variety of health outcomes such as breast and prostate cancers, menstrual irregularities, genital abnormalities in male babies, infertility in men and women, early puberty in girls, and metabolic disorder such as the skin disorder, increasing neurobehavioral problems, obesity, type 2 diabetes, and immune system effects. Children are more vulnerable to the illness because of exposure since childhood. Use of plastic container, bottles, and other items by children has become common. The long-lasting ill effect could be brought down through an awareness and modifications of the lifestyle at the early age of their life. Objectives of my studies. uh, this meta-analysis study comprehensively assess the awareness, attitude, and practice among the children regarding usage of plastic and its effect on the body. Methodology. A search of the PubMed, Medline, Senile, Open Access was conducted for this studies. Total 11 studies were included in this meta-analysis study. The total 850 students were selected. A total 850 students were selected from the 11 selected papers involving 1,323 students. In this review, meta-analyzing the standardized mean percentage of out of 850 students, 56% students used plastic tiffins, 37.53% were used water bottle, and 6.47 students didn't use any types of the plastics product. The results reveals that 16.67% students had inadequate knowledge, 38.33% had moderate knowledge, and 45% had adequate knowledge. 60.5% students had positive attitudes, and 39.5% students have negative attitudes. 49% students had poor practice, 44% had average practice, and 24% had good practice. The mean knowledge of students was 6.87 with 46.6% mean percentage. The median and standard deviations value was 12.5 and 1.73 respectively. Now discussions. The results suggested that most of the studies were used the plastic in many forms like tiffins, water bottle, etc. Most of the students had inadequate or moderate level of knowledge. Most of the students have positive attitudes, but the practice among the students was poor. On this basis, it was concluded that awareness programs regarding hazards on plastic use greatly needed for the children as well as their parents also. This can be given in the schools during parent-teacher meetings or in the community-based programs. For this purpose, educational departments of the state government can implement educational programs to the children's parents and teachers at all level of the educations. Thank you.
Thank you so much. Now we would like to have some comment on your presentation from Dr. Maharaj Singh. Dr. Maharaj Singh.
Mr. Deepak.
Yes, sir.
Actually, use of plastic is a very common problem, and the government also have taken many initiatives.
Yes, sir.
And many people have done the study, and you have tried to find out the matter. You did the meta-analysis study.
Yes, sir.
As I was observing your results, you have come up with certain exact values. How did you found these values?
From the various studies already researched papers, I have to find out the results, sir.
As 11 papers we have evaluated, 850 students who were totally enrolled in this. But as you have some knowledge and attribute exact values, how did you calculate these values?
All the studies in conclude is 11 studies in conclude in this result, sir.
No, I agree with that, but exact values, how did you calculate? I am asking that.
Okay, sir.
These values may range from lower to upper.
Yes, sir.
Result will not be exact.
Yes, sir.
Okay.
Okay.
Thank you. Okay, thank you.
Thank you, sir. Thank you so much. Now we'll proceed for the next presentation. Ms. Jeenat Fatuk, are you ready with your presentation?
Yes, sir, I'm ready. Good afternoon, everybody. Thank you so much for giving me an opportunity to present my paper here. Here I'm going to share my screen. I'm Zinat Farooq. I have completed my master's in obstetrics. Ma'am, am I audible?
Yes, you are audible.
Thank you so much. I have completed my master's in obstetrics and gynecology, and I'm a research scholar. My topic is a study to assess the effectiveness of VATM, video assisted teaching method on knowledge among antenatal women regarding the alarming signs leading to obstetrical emergencies. We know pregnancy danger signs are the major health problems and cause of mortality among women in developing countries, and majority of the maternal death occur in developing countries. Knowledge and practice towards identification of alarming signs of obstetric complications is the first step in the appropriate and timely referral to essential obstetric care. Although women's knowledge about the obstetric danger signs is important for improving maternal and child health, little is known about the practice to be done upon identification of alarming signs during pregnancy, labor, or postpartum, especially here in our Kashmir Valley. Due to lack of awareness about the danger signs of pregnancy, women fail to seek care in the right time for life-threatening complications of pregnancy and childbirth. And there are high levels of perinatal, neonatal, maternal mortality. These are the major public health challenges in India. About one-third of the neonatal deaths they occur in first year of life, and majority of the maternal death occur during labor, delivery, and within 24 hours postpartum. And among these, the major causes are hemorrhage, postpartum infection, hypertensive
Sorry to
disorders.
disturb you. Are you presenting through PowerPoint or you are presenting Word file?
Sir, it is PPT.
But
Sir, it is
I'm not able
PPT.
to see actually what you are. I'm not. It's not visible actually.
Not visible.
PPT is visible. It's not readable actually.
Actually, it seems to be in a Word file. It does not appear like PPT.
So actually, it is PowerPoint presentation only.
But it is clearly visible as Word file. That's why I think sir got confused. Am I right, sir?
Yeah, right, sir. Right, sir.
Sir, are the slides not visible at all?
No, it is visible, but it was appearing
Not
like
readable. It's visible but not readable.
Yeah.
Visible, not readable. So
Make it on full screen. Make it on full screen.
Okay. Sir, is it visible now?
It is in the same way.
Same way, actually, this is you are reading through WMS offices. This is Word
By
file.
the
Madam,
time, by the
continue.
time,
Anyway,
can
we
we?
have shortage of time also. Anyway, you continue with the same.
Okay, thank you. Now, the need of the study is maternal mortality is a grave injury to a family, community, and the entire nation, and the obstetric emergency has a profound effect on the mother and fetus, resulting in high maternal and perinatal morbidity and mortality. Majority of all maternal deaths occur in developing countries, and between 1990 and 2015, maternal mortality worldwide dropped by 44%, but still we are fell far short of the Millennium Development Goals, that is, reduction by 75% in the global maternal mortality rate by 2015. Now, it's of utmost importance that women at risk must be identified and managed appropriately, and timely intervention by a dedicated multidisciplinary team will help to prevent maternal mortality. This experimental study was conducted in this regard to make the pregnant women understand the alarming signs during pregnancy, labor, and postpartum period, so that which may lead to obstetrical emergencies, so that they may succeed to seek care in the right time for life-threatening complications of pregnancy and childbirth. The research objectives are to assess the pre-test practice towards identification of alarming signs leading to obstetrical emergencies among antenatal women in the experimental group and control group. Second, to assess the post-test practice towards identification of alarming signs leading to obstetrical emergencies among antenatal women in experimental and control group. Then effectiveness of VATM on practice towards identification of alarming signs, to find the association of pre-test practice score with demographic variables, and to find the association of pre-test practice score with the obstetric characteristics in experimental group and control group. Hypotheses were significant difference. H1 is significant difference between mean pre-test and post-test score. H2, there is significant association of pre-test practice of antenatal women leading to obstetrical emergencies with their demographic variables. H3 was the significant association was there will be significant association of pre-test practice of antenatal women regarding identification of alarming signs leading to obstetrical emergencies with the demographic variables. And H4 is there will be significant association of pre-test practice regarding identification of alarming signs leading to obstetrical emergencies among antenatal women with their obstetric characteristics in experimental group. H5 was there will be significant association of pre-test practice regarding identification of alarming signs leading to obstetrical emergencies among antenatal women with their obstetric characteristics in control group. The research design was quasi-experimental design, that is quantitative study. Independent variable was the video-assisted teaching method on practice of antenatal women towards identification of alarming signs leading to obstetrical emergencies. Dependent variable was the practice of antenatal women. Demographic variables which I selected for my subjects were age, weight, occupation, educational status, place of residence, availing use of social media for maternity information, and type of family. Then obstetrical variables were also chosen for the subjects. These were gravida, parity, gestational age, mode of last delivery, if cesarean, if multiparous, and number of live children. Then setting was the Khanim's Hospital and Nursing Home, Hazuribagh, Srinagar. The sampling technique was convenient sampling technique. Inclusion criteria: those who were willing to participate, who attended the antenatal clinic, who were present at the time of data collection. Exclusion criteria was those who were not willing to participate and who had some medical obstetric issue and not present at the time of data collection. The instrument that I used was structured interview schedule to evaluate the effectiveness of VATM on practice of antenatal women towards identification of alarming signs leading to obstetrical emergencies. The tool consisted of socio-demographic characteristics, obstetric characteristics, assessment of risk factors related to alarming signs leading to obstetrical emergencies, then practice assessment among antenatal women regarding identification of alarming signs leading to obstetrical emergencies. The VATM that I chose included it was a video based on these alarming signs, which included alarming signs during pregnancy, like vaginal bleeding, swelling of face, hands, feet, legs, continuous severe headache, blurred vision, breathlessness, decreased urine output, high BP, convulsions, severe backache, high fever, excessive vomiting, premature rupture of membranes, no fetal movements, epigastric pain. Likewise, alarming signs during labor and alarming signs during the peripurium. Then analysis and interpretation. It was found that majority of the females were in the age group of 20 to 29. Majority had weight 60 to 70. Occupation, majority were homemakers, and majority were having the qualification graduation and above. Then most of the women were from rural area, and most of them availed the use of social media. In experimental group and in control group, they did not avail the social media for maternity information, and majority of the subjects had joint families. They were from joint families. And when these obstetric characteristics were seen, it was found that majority had gravida 1 in experimental group and majority had gravida 2 in control group.
and most of them had parity 1 gestational age. Majority had 12 to 28 weeks of gestation, and mode of last delivery was cesarean in majority of the females, and majority of them had one live child.
Sir,
Yes. Is there any problem, sir?
okay, next.
No, have you done with this?
Sir, a few slides left.
Sir, time is over, sir.
Okay, then when the alarming signs were seen, it was found that majority of the females, they had the family history of medical condition actually, and also majority had the present obstetrical these complications, and it was also found that the females did not have any gynecological disease or nutritional deficiency. Then when this effectiveness was seen, it was found that pre-test score was less than the post-test score. Post-test score was found to be more in the experimental group, while as in control group there was no change in the practice score. This indicated that VATM was effective in improving the practice of the females, pregnant women, towards identification of alarming signs. Then when association was seen, it was found that this practice score had significant association with a gestational age, and they also had a significant association with age in years. Association of gestational age and age in years was significant with the practice score. Then a discussion. The findings are the findings of the present study. These are supported by the study conducted in 2021 by Gobran M, which showed that these results showed that there is an improvement in 63% of pregnant women knowledge and practice after educational program in all aspects. And then another study also supported the findings of the present study. The study that supported the present study was done in 2021 by Amora Saad, Zaki, and Shaima Ford. Then nursing implications, nursing practice. Educational program conducted by nursing personnel both in hospital and community areas help in improving practice of antenatal women towards identification of alarming signs. Then health information regarding healthy pregnancy can be imparted through various methods like lecture, mass media, pamphlets, information booklets, structured teaching program. Then in nursing education also, this study has implications like the student teaching experience that should emphasize on teaching pregnant women on various preventive and promotive health practices. Then in nursing research also, it is having implications. Nurses being the largest groups in the healthcare delivery system and being more close to the people should take an initiative to conduct further research regarding prevention of obstetrical emergencies. And so educational programs should always be conducted in the community to educate these pregnant women and the general public as well. The nursing administration, the nurse as an administrator should plan and organize educational programs for nursing personnel and motivate them to conduct programs beneficial to the pregnant women.
You have taken a lot of time. Sorry to
Sir,
interrupt you.
last slide. This is about the recommendations only. This study recommends in-service training programs and continuous supervision in rural areas to raise women's knowledge and practice regarding obstetric alarming signs. Thank you so much. This was all about the this presentation.
Thank you so much. Now we would like to hear from Dr. Karuna Sharma on your presentation. Dr. Karuna Sharma.
Yes. Hello.
Yes, ma'am.
Hello, Jeenat ma'am.
Yes, ma'am.
So, what are the obstetrical emergencies in this study?
Ma'am, it was found that the obstetrical emergencies were postpartum hemorrhage. Those
Yes.
I selected. It was postpartum hemorrhage. I also included the this placenta previa, abruptio placenta, then pregnancy-induced hypertension. These were
Yes.
the obstetric emergencies that I included in my study.
And excluded like?
And excluded like those who have the these ma'am, like if there is any abortion, like the trauma due to the trauma, or there is other obstetric issues like this
hydrated for mole. Such obstetric emergencies I have excluded in my study.
Okay, okay, thank you.
Okay, thank you. Now the next paper presenter is Mr. Mallikarjun. Are you ready with your presentation? Mallikarjun. Okay, maybe he's not able to connect us. Okay, so the next paper presenter is Pratibha.
I will share my PPT.
Okay, okay. So, Mr. Mallikarjun, are you unable to share your PPT? Are you unable to share? Okay, okay.
Sir, now
Yes, you can proceed. Hello, Mr. Mallikarjun, can you hear me?
you can hear my voice, sir?
Yes, yes, you are audible, and please try to finish it off as soon as possible.
Okay, okay, sir.
Okay.
Sir, myself, Mallikarjun Nepere. I am PhD scholar for Baroda University, Vadodara, Gujarat. My introduction: the world population was year 60 years predicted after 2 billion in 250. Rapid aging will be low and middle income countries. The significant economic, many people are living have a life without experience of mental health issues. The country to too many common perception of the elderly people being unhappy. So unforgettable, mental diseases are not unavoidable result of aging. There is my study is only for the improvement of the mental status of the older age. To assess the mental well-being of the old age people, objectives. The study area period was study. Hello. The study was conducted selected community area at Chikkodi. Study period was 1 month. The study design, the cross-sectional study was conducted at the objectives of study, the population, the source and study population, all old age people, 60 to 70 years residing at selected community area who can respond to required information without any difficulties, and inclusive and exclusive criteria. Inclusive criteria, all old age people who are residing at selected community area. The old age people are living in study area last for 6 months. Exclusive criteria, old age people who are absent during the data collection period. Sample size, convenient sampling technique selected 60 old age people. The dependent variable, mental well-being. Independent variable, age, religion, gender, educational status, occupational status, residence area, family monthly income. Operational definition, mental well-being, old age people. The data quality control, the data collection questionnaire were retest 0.5% of the sample size 1 week before, and actual data collection data will be viewed in area other than the study area. The following pre-test and tool will be edited and will change the meet the study of objectives. This is a demographic characteristic of presentation. And result showed that majority of the old age people, 56.6% were knowledge regarding mental well-being, 26.6% were poor knowledge regarding mental well-being, 6.7% were having a good mental well-being. There is a significant association between dependent and independent variable. P-value is below 0.05 level of significant. Conclusion: mental health is generally average, necessitating the intervention of numerous responsible entities, providing sufficient psychological support to the elderly and raising awareness about mental health. These are the reference. Thank you, sir.
Thank you so much. Now we would like to have comment on your presentation from Dr. Maharaj Singh.
Okay,
sir. Mr. Mallikarjun, I think you have valued the time. That's very important for us today.
Okay.
And in your study, you have said that it's a cross-sectional study design. What do you mean by cross-sectional?
Cross-sectional is a... Hello, sir. Hello.
Yes, yes.
Hello, sir. Hello.
What do you mean by
Yes, you are
cross-sectional
audible.
design?
No audible. Hello.
No, you are audible. You can
What
speak.
What do you mean by cross-sectional design?
Hello. Hello.
Maybe he is not able to connect us, sir. So we will have to proceed for the next presentation.
Okay.
So the next paper presenter is Ms. Pratibha. Are you there?
Yes, sir. Yes, sir.
Yes, you can share your slides and you can start your presentation.
Sure, sir.
And please mind the timing, please. Ms. Pratibha, can you hear me?
Yes, sir. Yes, sir.
Please mind the timing.
Sure, sir.
चलो फिर bismillah, ये काम तो कर लो आराम से। ये तो चलता रहेगा, ये नहीं रुकने वाला, ऐसा
Is my slides are visible, sir? Hello.
Yes, it is. Yes, it is.
Good afternoon to all. Thank you for giving me the opportunity to present my research presentation. And my topic is on effectiveness of nurse-led lifestyle intervention package on physiological outcomes among elderly with metabolic syndrome. Introduction of my studies: the metabolic syndrome, which is a complex web of impaired glucose tolerance, dyslipidemia, hypertension, and central obesity, which is associated with subsequent development of cardiovascular diseases and type 2 diabetes. According to WHO 2022 report, the global epidemic proportion of metabolic syndrome was estimated to be around 20 to 25%, and in Asian population, it was increased to 12 to 37%. And elderly with metabolic syndrome are at a greater risk of cardiovascular mortality and morbidity. The objective of my study is to assess the pre-test and post-test level of physiological outcomes of among elderly with metabolic syndrome in experimental and control group, to assess the effectiveness of nurse-led lifestyle intervention on physiological outcomes among elderly with metabolic syndrome in experimental and control group, to associate the selected demographic variables with the mean difference level of physiological outcomes among elderly with metabolic syndrome in experimental group. My research hypothesis are: there will be a significant difference between pre-test and post-test level of physiological outcomes among elderly with metabolic syndrome. There will be a significant association of selected demographic variables with a mean level of physiological outcomes among elderly with metabolic syndrome. So I have selected a quasi-experimental design, and my independent variable is nurse-led lifestyle intervention, and dependent variables are the physiological outcomes such as blood pressure and fasting blood sugar. I have selected old age homes in Chennai, and my target populations are elderly with metabolic syndrome who are residing in selected old age homes. The sample size is 60, and I have selected a purposive sampling technique. My inclusion criteria are elderly aged between 61 and 75 years, who are able to understand and communicate in Tamil language, and blood investigations such as FBS, HDL, and triglycerides done in the past 1 month by the elderly in old age home. The exclusion criteria are elderly who are bedridden, physically challenged, or with cognitive disability, who are not willing to participate and who are not available at the time of data collection, and who are practicing mindfulness intervention, yoga, and meditation. The data collection tools are the demographic variable, which consists of age, gender, education, marital status, habits, number of children, financial dependency, habits, and family history of metabolic syndrome. And physiological outcomes I have selected based upon the IDF definition, in which the systolic BP should not be more than 130, and diastolic BP should be more than 90 mmHg. And the fasting blood sugar should be more than or equal to 110 milligram per dl. And the data collection procedure, I have got a institutional ethical committee approval, and formal written permission was obtained from the selected old age home and from the participants. And I have done privacy and confidentiality was given, and the study was conducted for the period of 2 weeks. And after collecting the demographic variable, pre-test was conducted for both experimental and control group, and physiological outcomes such as blood pressure was measured, and fasting blood sugar was also measured for my patient. And nurse-led lifestyle intervention was given for experimental group, which includes the mindfulness breathing, mindfulness eating, body scan, mindfulness movement, and mindfulness guided meditation, which is given for the experimental group. The session which is lasted for 2 weeks, and the session which is lasted for 1 hour per day. And after that, post test was conducted, and for the control group, daily voltage routine was followed, and the results are uh, there was an increase in the mean value of blood pressure from 41 to 50 to 60.63, and fasting blood sugar was increased from 42.67 to 61.03, and there was a decrease of blood pressure in standard deviation from 8.72 to 7.99, and the fasting blood sugar, the mean value was increased from 8.42 to 6.89, and the T value is 11.20 was significant at P level of 0.05 level for blood pressure, and 10.42 at the level of P level less than 0.05 for fasting blood sugar. And there is a slight change in the post-test level of blood pressure and fasting blood sugar after giving the nurse-led intervention. The findings also, it provide the evidence supporting the conventional et al.'s conclusion, that is the MBI, which is a potentially effective treatment for hypertension, both systolic BP and diastolic BP. And the results also show a higher decrease in systolic BP, and it proves that the impact of MBI helps in reducing the blood pressure and blood sugar level among elderly people. But there was no significant association between the post-test level of blood pressure and fasting blood sugar among elderly with metabolic syndrome in experimental group. And this MBI are recommended, that is mindfulness meditation. It is recommended as a supplemental therapy for elderly population in conjunction with drugs, and due to their ability to lower blood pressure and blood sugar level, as is providing the positive results, the further RCTs can be implemented for the bigger sample, and better study designs also can be practiced in future. Thank you. So these
Thank
are
you
my
so much.
references.
Thank you so much. Now we would like to have a comment of Dr. Karuna Sharma on your presentation. Dr. Karuna Sharma.
Hello.
Hello.
Hello, Pratibha.
Good evening, ma'am.
So how to check the BP?
Sir, sorry, ma'am. I have checked the BP through Omron, ma'am. Sphygmomanometer. Electronics material.
Sphygmomanometer, electronic.
Yes, ma'am.
Before BP, you have already take any relevance or any calibrities?
Yes, ma'am. This I have selected from as it is having the 1 year validation calibration uh, from the company itself, ma'am.
Okay,
And
and
there is a website called Stripe BP
okay,
apparatus, and this a website is giving us calibration related to that only I have selected. And what instrument I have selected, it has a 1 year validation.
okay. And it means you have certificate.
Yes, ma'am.
Thank you. Okay.
Okay, thank you so much. Now we
Thank
would
you,
like to
sir.
have next paper presenter, Ms. Bimla Kaushal. This is Bimla Kaushal. Are you there?
Yes, sir. Good afternoon. Very good afternoon to all.
Okay, you can share your slides and start the presentation.
Just
Keeping in
try.
mind the time limits.
Yes, sir, I have a problem, but I'm trying just if it's possible. I have a problem with the room, sir.
You have a problem with the? I'm sorry, you're not.
Sir, this Zoom site, sir, I'm trying just, sir.
Are you not able to share your slides?
Sir, I'm trying, sir. That is visible, sir?
Yes, it is visible. You can start, but please keep in mind the timing.
Yes, sir. Very good afternoon to all, sir, respected experts. Myself, Bimla Kaushal, lecturer working at Government College of Nursing, Zindra Hospital, Patiala from Punjab. I'm just presenting a paper. So that is regarding to prevention of hypothermia in neonates among postnatal mothers. So neonatal hypothermia is defined by the WHO as auxiliary temperature that is less than 36.5 degrees centigrade is a major contribution to neonatal illness and death, both in the developed as well as the developing parts of the world. Out of 150 live birth aged 0.28 days, 62%, meaning 93 had hypothermia,
with an incidence of in which mild hypothermia accounted for 47.3% and moderate, that is 52.7%, and other than have the severe hypothermia. So neonatal infants are unique in their physiology and health problem that they experience. They are naked, wet, and have a large surface area to mass ratio. So with variable amount of insulator, limited metabolic reserves, and a decreased ability to shiver. So survival and health of neonates is very, very important. The most effective management strategy for hypothermia is its prevention. So need for studies, newborn hypothermia remains one of the most important contributors to neonatal mortality. So preventing hypothermia and maintaining a neutral thermal environment is important to prevent hypothermia and other complications. It can be done by medical and paramedical staff along with by adapting the measures of thermoregulation like
सारा
warm
ही गंद मान दुद्ध ते चढ़ा दो जेडी ਤੁਹਾਡੀ ਗੱਡੀ ਹੈਗੀ
and
ਗੱਡੀ
along
ਹੈ
with
ਨਾ
this contribution of the parents, especially mothers, should be educated regarding hypothermia and thermoregulation, like with the help of Ganga, in and promoting breastfeeding. So my problem statement is that a pre-experimental study to assess the effectiveness of information booklet regarding prevention of hypothermia in neonates among postnatal mothers at Government Rajendra Hospital, Patiala, Punjab. Objectives of these study was
हाँ पार्टियां क्या अपने को पार्टियां पाइयां छोटी हाँ चलो मुझे मुझे आहो पहला फड़ा रोड़े हो यार
कमलेश रानी कमलेश रानी
This Bimla Kushal was disconnected meanwhile, so we'll go for the next presentation. Kamlesh Rani, are you available to present the topic? Kamlesh Rani. Okay, we'll proceed for the next presenter, Rupali Salvi. Rupali Salvi. I think she is not there. Next paper presenter is Mr. Sanjay Soni. Are you available?
Yes, sir.
Okay, you can share your slides and start your presentation.
Okay, sir.
And please keep in mind the time limit.
आप बोल रहे हो क्या? तो कौन बोल रहे हैं?
Visible, sir?
Your slide is not visible.
Okay, sir. One minute, sir. Now visible, sir?
Yes, now it's visible. You can start your presentation. Your slide is not visible. Your screen is visible.
Okay, sir. Sorry for sir inconvenience. Visible, sir?
Your screen is visible. Your slides are not visible.
One minute, sir.
Okay, if you are not able to share your slides, we will share from our end.
Visible, sir?
No. We are sharing your slides. Don't worry.
Okay, sir.
Now, is it visible to everyone?
Yes, sir.
नहीं हुआ खुल तो गई
तो नहीं होगी।
ये
So, Mr. Sanjay, can you share your slides?
I
If you
try,
are-
sir.
Okay.
समाचार न्यूज आई कोई गूगल में
Hello.
चलो तो बंद है बजा आवाज तो वो नहीं अंदर बड़ा खलारा पिया बाहर वाला छप के अंदर भी हैगा पाउन वाला है ना आ वाला करके आ भी करके फिर अंदर भी हैगा ऐ
Because sir,
Is it visible to everyone?
visible sir.
Yes, sir. It is visible.
Okay, so Mr. Sanjay Soni, you can start your presentation.
Thank you very much, sir. So, good afternoon to all. Thank you very much to all respected members to give me opportunity to paper presentation. Am I audible to all?
Yes, you are audible. You can start.
Okay, sir. Thank you, sir. Myself, Sanjay Soni, working as Assistant Professor, Mahatma Gandhi Nursing College. I presenting the paper presentation regarding my study in the duration of MSc Nursing completed 2013. A study to evaluate the effectiveness of STUCK teaching program on knowledge, attitude, and practice regarding prevention of oral cancer among adults in selected urban community in Gwalior district. Introduction. The slide is not changed, sir. The human face is precious window to all world that emanates radiance, excitement, self-confidence, and happiness. Sadly, due to oral problems, there are frowns and tears in their faces, where bright smile and laughter should be. Today, many people needlessly affected with oral cancer because they cannot obtain timely preventive, educational, or treatment services. The burden of disease restricts activities in work, home, and often administered. The objective is to assess the knowledge, attitude, and practice of adults regarding prevention of oral cancer, to evaluate the effectiveness of STUCK teaching program on knowledge, attitude, and practice of adults regarding prevention of oral cancer, to associate the selected demographic variable with knowledge, attitude, and practice of adults regarding prevention of oral cancer. The next slide is the research methodology. A policy experimental one group pre-test, post-test design was used of the study. The study was conducted in Murar, is a particular place in the Gwalior. The investigator selected 75 adults between age group of 18 and 16 years in Morar community by using sample random sampling techniques. The study was approved by the research committee. The pilot study was conducted from 4th August 2012 to 11 August 2012 in Morar, Gwalior of effectiveness of state teaching program regarding knowledge, attitude, and practice of oral cancer among adults. 7 adults were selected for pilot study through sample random sampling technique. Reliability for the knowledge questionnaire was established by split half method. The correlation was computed by using Coromax alpha method, and the R equal 0.91 indicates high reliability. The main study data collection was done over a period of 4 weeks from 1st September 2012. The investigator assessed knowledge and practice on prevention of oral cancer with the use of structural interviews, schedule, and attitude with 4-point Likert scale through structured interviews. After pretest, the subjects were divided into small groups, 5 to 7 subjects per group, and structured teaching program on prevention of oral cancer was provided to each group through lecture, discussion, and demonstration. Flashcard and models were used as teaching aids. Poster was conducted after the gap of 7 days of structured program. The result is the section 1 distribution of subject according to their demographic variables. Demographic data show 42.67% subject were in the age group of 26 to 35 years. 56% of them were male amongst the subject. 32% were illiterate, majority of them. 56% were married and 49.33% were poorly. 41.33 the result, section 1 distribution of subject according to their demographic variable. Demographic data show 42.60% subject were in the age group 26 to 35 year. 56% of them were male amongst the subject. 32% were illiterate, majority of them. 56% were married and 49.33% were poorly. 41.33 of them were earning rupees 2,500 rupees to 3,000 per month. 97.33 subjects belong to Hindu religion and 50.67 were living in a nuclear family. In this, the discussion in the aspect of knowledge of adults regarding prevention of oral cancer, 57.3 subjects said that prevention of oral cancer, 30.7 subjects knew that vitamins reduce the risk of liver cancer. Nearly 44% subjects said the sources of vitamin A. 24.0% subjects said the sources of vitamin C. 13.3% of the subject responded that lower denture has to insert first, and 16 notes that how to identify the xenophobia cancer removal committee. The knowledge of adults regarding prevention of oral cancer were poor, and some of the subject are adequate knowledge. 40% had moderately adequate knowledge and 60% had inadequate knowledge respectively. Thank you, sir.
बढ़िया पढ़ रहा है.
Now, we would like to have some input from Dr. Maharaj Singh on your presentation. Dr. Maharaj Singh.
Yeah, Mr. Sanjay, what are the weaknesses of your study? Mr. Sanjay, can you list out certain weaknesses of your study?
Sir, I think he's not able to connect us.
Okay, sir. Okay, sir.
We'll proceed for the next presentation. So Mr. Surendra Singh is the next paper presenter. Are you there to present the paper? Mr. Surendra Singh. Mr. Surendra Singh. Maybe he is not able to connect us, so we'll go for the next. Mr. Rahul Vyas. Mr. Rahul Vyas. Next, Sakshi Sharma.
Hello.
Yes, Miss Sakshi Sharma, are you there?
Yes, sir.
Okay, so you can share your slides and you can start the presentation.
Okay, sir. So my screen is
Yes, your screen is visible.
okay, sir.
And please keep in mind the time limit as well.
Okay, sir.
Okay, thank you.
So good afternoon, sir, and thank you for giving me this opportunity to start my paper presentation. So my topic is cognitive coding in artificial intelligence touch. So we are two hours for this review presentation. Just a minute. We are two authors for this review presentation. Me and Mr. Shubham is the co-author for this review article. So this is the abstract. And you might have seen the Hollywood movie. So one of the Hollywood movies that was the Star Wars, The Rise of Skywalker, is a 2019 and it is an American movie in which they used a midwife droid, which had the white faces and lights were there sensors. They deliver a baby twins in space. So this is the telemedicine and telenursing, so which is mainly used in the era of futuristic nursing. And here we have the removal of time and distance barriers for the delivery of healthcare services and related healthcare activities through telecommunication technology. Just a minute, it's E. So the impact of artificial intelligence and machine learning on nursing and midwifery. The scope of artificial intelligence in maternal and child health, which says, and it is mostly important for the predictive modeling. What is predictive modeling? It is one of the most promising applications of AI in the maternal and child health. And what the AI does in this case, it analyzes the large amounts of medical data, and with the AI algorithms, it can identify the risk factors for maternal and fetal complications, and it can predict the likelihood of the development of complications. So we have the benefits of AI, in which the most common is the intelligence augmentation, which increases the intelligence, and the cost reduction will be there. And once it is like increasing the efficiency, and it will be multiplication of workforce will be there. So the cornerstone in India, which was led by the Arogyam ICT based, it was an initiative which started in UP in 2008. So this mainly focuses on the antenatal and postnatal care, and this uses the automated records of the like voice calls were generated, and then it was implemented in the National Rural Health Mission. Then we have the Government of India initiatives at grassroots levels. So at grassroots levels, we have seen that there is one app which is called as Anmol. So which is mainly for ensuring the effective and timely delivery of the quality health services. And Anmol is derived from the auxiliary nurse midwife online. So that has been implemented across India by Ministry of Health and Family Welfare. So it aims to empower the ANMs in the fields in the country. Then we have the Kilkari program. It is a mobile-based service launched, and it was launched on 15th January 2016 as a part of Digital India initiative for new and expectant mothers. So Kilkari delivers free and weekly time-appropriate audio messages about the pregnancy, childbirth, childcare via interactive voice response to women registered in the RCH portal. Messages begins in the second and third trimester of the pregnancy, and it continues till the child is 1 year of age. The Kilkari project serves 18 union territories and the states, and 2 more have been added, which is the Rajasthan and Gujarat in 7th February 2024. Then we have Mobile Academy, which is a free audio training course which is designed to expand and refresh the knowledge of ASHA workers. Then there is one more upgradation that India is about to come up with, which is the Garbini GA2. It is India's first specific artificial intelligence model which can precisely determine the age of a fetus in a pregnant woman in the second and third trimester, jointly developed by the IIT Madras and STI Faridabad. Then we have a safe delivery app which provides skilled birth attendants instant evidence-based and up-to-date clinical guidelines on how to handle the complications related to pregnancy and childbirth, and which can be done straight through the phones or their tablets. It was developed with the University of Copenhagen and Southern Denmark, and the app uses simple features and animated instructions and videos. It is an e-learning tool which is basically used to guide the skilled birth attendants in emergency obstetrics and newborn care. Users can achieve a formal certification and become a safe delivery champion. I have completed all the modules and have undergone that exam of this app, and I became a safe delivery champion through this app. Now I will take you to the AI-assisted modern motherhood journey. So once the woman suspects that the pregnancy will go to, she will go to a hospital. She will encounter a pepper as our hospital receptionist who will register a woman in the hospital. Then advancing AI will help her detect the genetic disorders. AI will have the potential to analyze the extensive data to uncover the potential associations, thereby enhancing the prevention, diagnosis, and treatment and monitoring based on the individual genetic profiles. As the modern mothers will be very much busy doing their work, so the robots will be there to nurture their kids at home. The various robots will be used as toys for kids, which will help them to learn coding and understand the emotions. So STEM, which is like we have various group of technologies like science, technology, engineering, and mathematics. So it is an interdisciplinary and applied approach rather than teaching just the 4 disciplines separately. So we have Vortex, Miko 2, Little Sophia. These are some of the examples of robots which can be used to train kids. And there will be more nuclear families where some of the robots will play the role of a home companion like Linux and Buddy. So Pillow will also serve as a AI-powered health companion to remind people to drink enough water and to remain hydrated. As AI is advancing, we need to have a cautious for AI-related concerns which are emerging in healthcare. So the first one is a fear that it will replace human minds. There are high chances of copyright violation and leakage of the sensitive information. Data privacy violations can be there, and there is an increased need for learning about the artificial intelligence. Then we have the high-level panel on digital cooperation was convened with the United Nations Secretary General to provide recommendations on how international community could work together to optimize the use of digital technologies and mitigate the risk. So in June 2019, the panel published their report, The Age of Digital Interdependence, and with it is a series of recommendations to improve the digital cooperation, which gives a theme of trust, security, and stability. And they recommend the development of global commitment on digital trust and security to shape a shared vision, identify attributes of digital stability. So minimum competencies focusing on AI in nursing and midwifery must now be incorporated into the curriculum of all the graduate and undergraduate programs. Midwives should become vigilant in the employment of AI in health sector to enhance the care delivery to mother and child diet. These are my references. Thank you so much.
Thank you so much. Now, Dr. Maharaj, you would like to have some input on this presentation from your side.
Yeah, Miss Sakshi, actually, you have presented the theoretical literature on the importance of artificial intelligence in healthcare as well as in the field of nursing. I think it's much more informative that how at the global, at the Indian level, actually we are start utilizing the artificial intelligence. It's good, but I think this session was for original research article presentation, but it's no issue. Anyway, good. Thank you.
Thank you, sir. It was a review article presentation, sir.
Yeah, it's a theoretical literature. It's not research-related review articles. Yeah, it's theoretical literature you have presented.
Yes, sir. But this is also one of the kind of like research only. Review
Accepted. No, it's not. Research is different thing. How it has emerged and how what kind we can utilize is much more further that you have presented. It's okay.
Okay, thank you. Thank you, Sakshi. Now the next paper presenter is Shubham. So,
hello, sir.
Yes. Are you ready with
Good
the
afternoon, sir.
presentation?
Yes, sir. Yes, sir.
Okay, so you can share your slides and start presentation by keeping in mind the time limits.
Okay, sir. Okay. Good afternoon, everyone. I'm Shubham, working as an infection control nursing officer at All India Institute of Medical Science, Gorakhpur. This is a review article titled as Artificial Intelligence Driven Healthcare. I'm the author, and Ms. Sakshi Sharma is a co-author of this review article. Abstract. A basic quality, moral requirement, and expectation of a nursing and caregiving profession is caring. It has long been believed that nurses are medical professionals who provide safe, sympathetic, and compassionate care. In addition to providing care, nurses are required to do more complicated jobs and activities. AI and assisted care robots are fast transforming the healthcare scenes, partially due to the increasing physical, intellectual, and emotional demand of nursing combined with technological advancement. AI can be used as a predictive algorithm to assist in healthcare delivery. AI has significantly impacted workload and clinical workflow by integrating machine learning into health sector. Differences in the interinstitutional interpretation of data from artificial enabled entity may lead to the adverse outcome. Data bias issue could be a challenging aspect. Patient privacy is an integral part of advanced care delivery using artificial intelligence. Due to advanced automation, there is a high chances of needing more empathetic care. Nurses need robust training, education, and guidance for using artificial intelligence software and technologies because of the potential clinical risk that might affect patients and the community. The need to incorporate artificial intelligence into the nursing care will only grow as a possibility arise and the technology get more sophisticated, cost-effective, and efficient. Artificial intelligence, a new electricity. Here I would like to begin this presentation from a speech given by Stephen Hawking at the opening of Lorium Center for Future Intelligence, Cambridge, UK, October 2016. I believe there is no deep difference between what can be achieved by biological brain and what can be achieved by a computer. It therefore follows that computer can, in theory, emulate human intelligence and exceeds it. Artificial intelligence is often referred to as a new electricity. Artificial intelligence is ready to change the world we live in, just as the invention of electricity has changed the way we live, work, and play. Shortage of healthcare worker. Even in the digital era of things, machine
क्या चैनल
I think Shubham is not able to continue because his internet connection is impaired. So we will move with the next paper presenter, Mr. Sunil Shingare. Mr. Sunil.
My voice is audible, sir?
Yes, yes, you are audible. You can start your presentation.
Okay, sir. My screen visible, sir?
Your screen is visible, but if you can zoom it out, that will be better.
Okay, sir. Okay, sir. Okay, sir.
Can you convert it into portrait instead of landscape?
Okay, sir. Okay, sir. Visible, sir?
Visible, but it's not fully visible.
Okay, sir.
Yeah, now it is okay.
Okay, sir.
Mhm.
Okay, sir. Thank you, sir.
Please keep in mind the time limit also.
Okay, sir.
Okay.
Good afternoon, all of you. My name is Sunil Shingare. I am Assistant Professor of Jizamata College of Nursing, District Bid, Maharashtra. Today, I am very much excited. Beautiful program, beautiful platform, which is the research teachers and students. My topic is a study to assess the effectiveness of food reflexology on peripheral vascular circulation among patients having type 2 diabetes mellitus admitted at selected hospital of CT. Next part is introduction. Diabetes mellitus, often simply referred to as a diabetes, is a condition in which a person has high blood sugar either because the body does not produce enough insulin or because cell does not respond to insulin that is produced. Diabetes is a lifestyle related condition due to imbalance handling glucose and is not disease. It is one of the several lifestyle related chronic condition which and result of complications that are related to early sign aging changes resulting to blockage of the small and large artery. Next is a reflexology is a natural non-invasive therapy which uses only the therapist mainly their thumbs to apply gentle pressure to the feet or hands to encourage the body to rebalance itself its own pace, often counting lifestyle misuse. Next is a objectives. To assess the level of peripheral vascular circulation score of patient having type 2 diabetes mellitus, patient among experimental and control group. Second objective is to find out the effectiveness of foot reflexology on a peripheral vascular circulation patient having patient with a selected demographic variables. Next is a hypothesis. Hypothesis is a first hypothesis is a there is a no significant differences between pre-test and post-test level of peripheral vascular circulation score on type 2 diabetes mellitus patient. Second hypothesis is a there is a significant difference between pre-test and post-test level of peripheral vascular circulation on type 2 diabetes mellitus patient. Third hypothesis is a there is a no significant association between pre-test level of peripheral vascular circulation score of type 2 diabetes mellitus patient with selected demographic variables. And a fourth hypothesis is a there is a significant association between pre-test level of peripheral vascular circulation shown on type 2 diabetes mellitus patient with selected demographic. Next is a methods of study. First, next research approach, quantity research approach, research design, one group pre-test and post design, target population type 2 diabetes mellitus, pattern of selected hospital, assessing pollution, type 2 diabetes mellitus patient of selected hospital, sample technique is a non-probability persuasive sampling, sample size 60 type 2 diabetes mellitus patient is selected hospital in Matoshri Hospital of Nashik. Setting is a selected hospital of Maharashtra, and a tool is a structure knowledge question including demographic variables modified scale. Next is a I used for the sampling demographic variables is seven demographic variables of patient with a diabetes type 2 diabetes mellitus among experimental and control group. First demographic variable is age, second is gender, family income per month, occupation, specific habits, types of job, and a family history of diabetes mellitus. Next is I used for pain scale of the peripheral vascular circulation with after reflexology severe condition is a normal, mild, moderate, and severe. After discuss the discussion,
Left where? अब sir, I got removed. Shall I continue after current presentation? नहीं ये remove क्यों करेंगे भाई? रेणुका को बुलाओ सर. This is technical problem.
Mr. Sunil, we are trying to reconnect you.
Yes. Hello, sir. Can I continue?
Technical problem.
By the time we can ask to Renuka to start her presentation if she is there. Renuka Majumdar.
Yes, sir.
Yes. Are you ready with your slides?
Okay, yes, sir, I'm ready.
Okay, then you can start your presentation.
Okay, sir. Sir, my screen is visible.
Yes, your
Hello?
slides are visible. Yes, you can start.
Okay, sir. Okay, sir. Good evening, sir. Thank you for this opportunity. My topic is 1 minute. Sir. Okay, sir, I started. My problem statement is a descriptive study to assess the knowledge regarding subcutaneous insulin injection among diabetic patients. Those are attending OPD of selected hospital. The introduction is diabetes mellitus is one of the most common non-communicable chronic disease. World Health Organization described that diabetes mellitus is a metabolic disorder of multiple etiology characterized by chronic hypoglycemia with disturbance of carbohydrate, fat, and protein metabolism result from defect in insulin secretion. And the insulin is a hormone that treats diabetes by control the amount of sugar in the blood. When used as a medication, it is derived from the pork, beef, and it is genetically made to be identical to the human insulin. Next, objectives. First objective is to assess the knowledge regarding subcutaneous insulin injection among diabetic patients attending OPD of selected hospital. Second objective is to prepare a distribution on information pamphlet on regarding subcutaneous insulin injection among diabetic patients attending OPD of selected hospital. Third objective is to find out the association between knowledge and attitude on insulin therapy with the selected demographic variables. Next is assumption. The study assumed that the diabetic patient has inadequate knowledge regarding self-administration of insulin injection. Methods are first research approach, quantitative research approach. Second is research design. Design is non-experimental descriptive research design. Setting of the study is district hospital, Chhattisgarh. Next samples are diabetic patients. Next sample technique, non-probability convenient sampling technique. Sample size are 60 sample. And tool, the tool is consist of demographic data and self-structure questionnaires. Next, result, my first table is distribution of subject according to socio-demographic variables using frequency and percentage. First variable is age groups. In that, 20 to 25 age group, 26 to 30, 31 to 35, and more than 36. The frequency is 4, 13, 20, and 23. The gender, in that male and females, The frequency is 43 and 17. Religious, Hindu, Muslim, Christian, and other. The frequency is 32, 14, 7, and 7. The education, there is no formal education. The frequency is 16. Elementary, the frequency is 9. Higher secondary is 22 frequency, and graduate and above are 13 frequency. Next is family monthly income. In that, 10,000 to 20,000, 20,000 to 30,000, and more than 30,000. The frequency rate is 19, 20, 13, and 18. It is shown that according to the majority of subjects, there is a group of age 36 and gender, religious, all these things will show the significance variables. Next, the second table is area-wise analysis of knowledge score by using median, mean, percentage, standard deviation, and CV. In that area of knowledge, the introduction of diabetes mellitus, introduction of insulin injection, reason of insulin injection, sites of insulin injection, method of administration of insulin injection, and complication. Next is discussion. The major findings of the study show that there is association between knowledge level and other selected demographic variables. Variables are such as age groups, family monthly income, gender, religious, and all these socio-demographic variables. The statistical analysis was done by X2 test, where the overall calculated by X2 value was there compared to the calculated X2 value with degree of freedom at the level of 0.05 significance was showing at high level of significance, making the conclusion that structure questionnaire is effective. Effective in improving the knowledge of diabetes mellitus. Those are taking the insulin injection. Thank you, sir.
Thank you so much. Now, Dr. Maharaj, we would like to have some input from your side on this presentation.
Yes, sir.
In case of actually split half method, how you establish the reliability of the tool?
Yes, sir.
Through split half method, how you establish the reliability of the tool? My question is, through split half method, how we establish the reliability of the tool?
नहीं और
I think she is not able to connect us, sir. So,
Okay, sir. Okay, sir.
so we will start with the another participant, Mr. Sunil Dadich.
Yes, sir. Yes, sir. I am available, sir.
So you can share your slides. You
Yes,
can
sir.
start your presentation by keeping in mind the time limitation.
Yes, sir.
Okay.
Sir, it's visible.
Not yet. It is not visible.
लैंग्वेज भी अच्छी से बना
Yes, sir. Visible, sir.
Yes, now it is visible. You can start.
Sir, good afternoon, sir. All of you, sir. My topic is effectiveness of video-assisted teaching program on knowledge level. Knowledge level regarding the home care management of preterm babies, a quasi-experimental study. Introduction of the study is the preterm baby is defined as the time when the birth of any neonate occur before the end of the last day of the 37 week of gestation. Premature baby is the very important concern. There is the morbidity and morbidity rate is the 8 to 10% of overall the premature babies. Objective of the study is that to assess the existing knowledge on the home care management of the preterm babies before the video assisted teaching program in experimental and control group. Second one is the to compare knowledge on home care management of the preterm babies in experimental and control group. And third one is the to find out the association between the level of post-test knowledge and score on the home care management of the preterm babies with the selected demographic variable between the experimental groups. My research methodology is the research approaches is the quantitative research approach, and the research design is the quasi-experimental research design. Research setting is the selected hospital of the Udaipur, such as the Pacific Hospital and the Gitanli Hospital and American Hospital, etc. Population in the present study, the population comprises of all mothers of the preterm babies residing at the Udaipur districts. Simple and sample techniques. There are the total of 347 sample were chosen by the convenient sampling. My sample technique is convenient sampling techniques. In this, the 173 sample are the experimental study and 174 in the control group. Criteria of the selection of the sample: mother who can understand the write in English or Hindi will be selected as the sample. Mother who are physically and mentally prepared to attend video assisted teaching program. Data collection tools section first consists of socio-demographic variables, and second is the assessment of knowledge will be done using self-structured question. The question is consist of the 1 marks and the wrong answer is 0 marks, and total question is 30 questions. The scoring pattern is 1 to 15, 50%, inadequate knowledge 16 to 20%, 51. The result is the demographic variables include the most common age in 26 to 30 years, and experimental group in 51, and control group is 55. And the religion is the the majority of people are Hindu, 125 in experimental, and 122 in the control groups. In educational studies, the most common is secondary level of school in experimental 64, and in control group is 62. Type of family: nuclear family is 65, and the combined family is 76. Monthly income is the most common is below 10,000. Below 10,000. Occupation is the most of the women are house makers, 41%, and in experimental 44%. Area of living: most commonly women in urban area, and in 47% in rural areas. Parity, most common is the para first, 57.22%, and in control group 54.62%. Attend any educational activities on home care management of the preterm babies? Yes or no? About the 12.14% attend the educational program, and 87% are not attending the educational programs. Section B, the comparison of pre-test and post-test score of the knowledge regarding home care management of preterm babies among the mother in control and experimental group. Table 2, pre-test and post-test score knowledge in control group. N1 is 174. Level of knowledge regarding preterm care: inadequate knowledge 128. About the 70 in pre-test score, 73% women have inadequate knowledge, and moderately adequate knowledge 20%, or adequately knowledge is 6%. Frequency is 125, and moderately educated frequency is 37%. Next, the table: pre-test and post-test score knowledge regarding the experimental group. Level of knowledge regarding the preterm care of the inadequate knowledge in experimental group. Inadequate knowledge is 127, frequency and percentage is 73%, moderately 19%, adequately 7.51%. Table is comparison of mean and pre-test and pre-test and mean post-test of the knowledge in control group and experimental group. Control group is 170 pre-test and post-test. Means 13.78, post-test 13.98. Standard deviation is 3.88, and post-test 3.49. Experimental group pre-test is 14.19, post-test is 22.94. Table 7, a comparison of mean and mean post-test score of the knowledge in the control group. Experimental group is N is to 347. Control group N 174. Mean 13.97. Standard deviation is 3.83. Experimental group N 173 to mean is 22.94, and SD 3.11. Section C, association between the pre-test knowledge scored and the demographic factor in the control and experimental group. On the basis of chi-square test calculation study, result found that there are significant association between the pre-test knowledge and scored attended any the educational activities educational activities on the home care management of preterm babies in control group 9.868 and the experimental group X square 5.796, and the rest of demographic variable had the no significant association found between the pre-test knowledge score in both control and experimental group. Discussion pre-test. Present study relevant at the 73.56 mothers is the control group and 73.41 in the experimental group had the inadequate knowledge pre-test regarding the preterm care at home. Saliva HM et al. 2020 also discovered that the 53% of mother and inadequate knowledge about the premature infant health. Nagy H et al. 2019 found that 94% mother had the average knowledge on the premature infant care among the mothers. Our study findings supported by the Sijo J et al. 2022 research study in which they found an effectiveness of the educational information in increasing knowledge and awareness regarding care of neonatal jaundice among the mother of preterm babies admitted in selected hospital. Lavens Subani at the 2018s and the Saliva HM et al. 2020s and Bajaj Divansi in 2019 that support our study. Conclusion of my study is the study identified that the most of the mother in both control and experimental group had the below average knowledge score regarding the care of preterm home in pre-test, which was increasing after the video assisted teaching program in experimental group only as video assisted educational information was provided to the experimental group only. Thus the study suggests that the need of regular continuous educational program for the mother and expectant mother to prevent the complications in the preterm babies to regulate the growth of the preterm babies. Thank you, sir.
Okay.
Thank you so much. Now here we come to the end of this conference today. I would like to inform all the professionals who presented their research paper that their certificates shall be provided within a week approximately. Afterwards, I would like to thank a lot Dr. Maharaj Singh and Dr. Karuna Sharma for judging and giving insightful input on the research paper presented today. And I would like to thank all significant contributors to make this conference a great success. Hopefully, we will have this type of conferences in the future as well. Thank you so much. Thank you.
Thank you, Dr. Vikas Sharma, sir. As nicely you have handled the scientific session, and I thanks all the members of Federation of Nursing Services Organization for giving such an opportunity for being as a jury member, as well as for organizing this workshop successfully. So thank you.
Thank you, sir. Thank you so much. Dr. Karuna Sharma, would you like to give some input on this conference? Or any further suggestions we can incorporate in future conferences? Okay. I think she's not there. Any other participant? Anybody would like to give any suggestion? Any input? Okay, then thank you. Thank you so much.
Thank you, sir.
Thank you, sir.